Hello, everyone. My name is Ifeoma Ude, and I'm so excited and honored to be the host of today's WSPID podcast. It promises to be exciting and interesting. I will be interacting with a very senior colleague in the field of pediatric infectious diseases. But before we delve right into the discussion, let me do a bit of some introductions of myself as well as my guest. So, as I said earlier, I'm a pediatrician, a pediatric infectious disease specialist in Nigeria. I had my medical training here, had my residency training at the University College Hospital Ibadan, and I also received a bit of training experience at the Red Cross War Memorial Hospital in Cape Town. And I recently qualified as a pediatric infectious diseases specialist. I actually came in contact with WSPID first in 2022 when I won a participation grant to the conference because I presented our research on COVID-19 outbreak and its containment in my hospital then. After then, I was invited as an African speaker for Young WSPID Group in 2024, and then I applied for the research grant and I was one of the recipients of the WSPID research grant. So in a nutshell, that is me. Now to my very special guest. He is Professor Mark Cotton. He is an emeritus professor at the Stellenbosch University. He had his medical training at Denver, Colorado, and upon his return, he set up a pediatric HIV clinic from where many pivotal research studies on HIV in children were conducted. He is the chief editor of the Southern African Journal of Infectious Diseases, and he also joined WSPID in 2011 when he attended the WSPID conference as an African representative, after which he became very instrumental in the formation of African Society for Pediatric Infectious Diseases. So please welcome with me Professor Mark Cotton.
Hello, and thank you for the introduction. And it's lovely to talk to you, and especially as a recipient of the first WSPID research grants. So really, it's fantastic that we are talking today. Thank you very much.
Thank you so much, Prof. It is a pleasure to have you here today. Thank you. And it's our 30th anniversary for WSPID. I'm just wondering, 30 whole years, how has it been? What was it like 30 years ago, identifying children with infectious disease, treating and managing them? What was it like 30 years ago, Prof?
It's a good question. And of course, I can't answer that because the first conference was in 1995 in Mexico. And that was a really visionary movement by Professor Napoleon Gonzalez and his colleagues who had the idea to establish this World Society for Pediatric
Yes,
Infectious
yes.
Diseases. I did look at the program, and there is one African speaker from Nigeria, actually. And in fact, the Nigerian Infectious Disease Society has always been part of WSPID from the very beginning. So I think it's really notable. I can also add there is the International Society for Infectious Diseases as well, and that has recently, at the end of 2024, held its biennial meeting in Cape Town again. I attended it and found it really, really interesting, but very different to WSPID in that pediatrics is a part of it, but not the whole of it. Whereas in WSPID, it's all pediatric infectious diseases. And as PEDS ID people, we attempt to set an agenda that is very meaningful for us and our colleagues, with an emphasis that is touched on elsewhere, but really very, very well addressed in WSPID. So looking again at the program from 1995, and I just did have a look at it out of interest, it's not that different to what we're talking about now. It's various infections in various age groups, immunization, neonatal issues. It's the kind of things that one would expect to see. So I would say that one of the differences, I won't even call it a difference, one of the developments is the global reach of WSPID since those days. It was really focused on the Americas and a little bit of the United Kingdom and Europe, but really not, to my memory, not much elsewhere. And over time, it has changed and has developed and become more global. I do think for people like you, Ifeoma, and emerging infectious diseases specialists and people even mid career, it's a wonderful platform for you and for me, of course, to interact with colleagues globally and find out that we really have so much in common. And of course, there are differences, there always are, but those differences are important and educational because we learn from one another. Our approaches just improve all the time through this kind of interaction.
Thank you very much, Prof. That was quite insightful. And it brings me to my next question because I've been wondering how was WSPID able to, foster collaborations across the globe? We have the Africans, the Americans, the Europeans under one big umbrella. How were they able to achieve this very noble objective of fostering these global collaborations under WSPID?
Hmm. Well, I think it's a good question, and I'm not sure. So I can obviously give my uh, thoughts about the way it went. And I think the first point is that WSPID holds a international conference every second year, and it also holds these congresses usually in. This is my cat Layla who's joining us.
Oh,
I can't keep
okay.
her away. Having the conference as a focal point over a 2 year period and repeating itself, and also of late has rotated really to parts of the world that we can describe as upper middle, lower middle, and lower income settings to really bring the Congress delegates, the invited speakers, the experts to parts of the world where their knowledge and insights are important, and of course to give people an opportunity to attend. So I think the constancy of the conferences has been important. Another important development has been the regional societies, and having I'm not sure what the oldest society is, but very very well established societies in the United States, PIDS, Slippy in Latin America, AfSPID, which I think is fairly recent as well, in Europe, and ACID in Asia, and then of course ANSPID, all of the acronyms in Australia, New Zealand, and these are really development grounds for the next generation of infectious diseases specialists, and a very important platform for established specialists and researchers in the field. So I think that has been really really good. I would say that Africa was a late joiner, and but at least thankfully we do have a society, and the society, well, it exists, it contributes to WSPID, it contributes very well. And I do think, and I know that we have a long way to go in the African society as well to make it stronger than it is now. I think it's pretty good. But these societies are very, very important for all of us.
Oh, that's interesting, Prof. I was just wondering, how would you, in your own assessment, the training in the field of pediatric infectious diseases, how has it evolved over the years, like from inception to where we are now? What would be your assessment of the training in this noble field
Oh,
of
no, thank you.
ours?
It's a really important question. I think the first point is that WSPID has a large conference every second year, and that is a focal point in the calendar. It brings together a scientific committee that's international and that meet on a regular basis. and plan the program. And it then goes on from 2 years to 2 years. People meet at the conference and establish ties. So the conference is very, very important. Another important aspect is all of the regional societies that have developed and are the core and contribute the core of the leadership into the board, and also contribute to other committees within WSPID. So that is another important aspect. The regional societies are very well established. The latest, youngest is AfSPID, the African Society. That was, as you said, it was established in 2012 and has contributed to WSPID since then. AfSPID, I think, is the most challenging society because of the way Africa is and the largeness of the continent and the regional distances between the various countries, different languages, which is another challenge we have to face. But I think all of these challenges are solvable. I really am looking forward to more progress over there. I think how WSPID really became more global than it was is through the portal and having an online access. And the planning for this actually began in round about 2018, led by Dave Bergner, who was chairing the education committee, which was really just a very few people. And their brief previously had been the research workshop and the research workshop only. That's another aspect we should actually talk about. This working group came up with the idea of an electronic platform for e-learning for WSPID. And they developed terms of reference and very technical specifications for what this portal should be. And when I became the president at the end of 2019, I was faced with the task of leading the process of calling for applications, trying to evaluate the technical aspects of the various applications. And that was also an interesting process and difficult. And what I learned is go to the experts. If I know nothing about IT, it doesn't mean that there aren't people who do know about IT. And as long as we can talk to them and understand what they're saying, and they can understand what our needs are, we're going to make an informed choice. And I do think we have made an informed choice, and the growth of the portal, I think, has been phenomenal. Really, really enjoy the portal. It's interesting. There's lots going on there. Case studies, webinars, now podcasts. So it really, really is very, very interesting. And it's also led by a very dynamic and very patient education manager, Konstantina Akrevu, who puts up with all of us and our busyness and our fragmented times, but manages to not only hold things together, but actually get the program running and keeping it running. So her assistant is someone called Johonatan, who's also excellent, and they have a good team. And I think that is really fundamental to WSPID's attraction. Another point, and especially shown in the portal, is the involvement of PEDS ID people from around the world. So and as you know, we are all colleagues. We have the same goals, just to look after children with infectious diseases and to inform the communities, to help the parents, work with our colleagues. And we are coming in at different levels. And we have people like you who are new, and some people who are established, and some people like me at the other end who are a little bit on the old side. But there's place for all of us, and it gives all of us a global platform and a global reach to interact with one another. I do think we have a lot of similarities. I've said we all have the same goals. We also have lots of differences. We have different resources. We have different challenges in healthcare. Some of the South African challenges are just unbelievably tough. And I'm sure Nigeria
Nigeria.
probably has has its
Yes.
issues. Uh, so
Yes,
um, you know,
Nigeria.
so we work in difficult environments, but together, and having a platform, and comparing responses and strategizing, all of these aspects are facilitated by a portal and by a presence, and also using the infrastructure and contributing to the infrastructure that WSPID has created over the years. So I think it's exceptionally exciting, and we must do everything we can for it to continue and to expand.
Yeah, thank you so much, Prof. Yeah, and I absolutely agree with you. I mean, you've talked about how it was 30 years ago, how we've evolved over time in terms of
Yes.
training, in terms of capacity building resources across the globe. And that is very, very insightful. Then I would be wondering, what advice do you have for incoming professionals in the field of pediatric infectious diseases, young pediatric infectious disease specialists like myself, pediatricians who are still considering, subspecializing in this field? What career advice do you have for us in terms of professional advancement?
Wow, that's a very difficult one. But I think my first advice is to do it, and, to be passionate about this field. I remember when I became interested in pediatric infectious diseases, it was actually a discipline I'd never heard of. It was totally, didn't know about it. I was going to become a pediatric nephrologist when I was doing my residency. This is what moved me. And part of my rotation was on the WITS circuit, Johannesburg, the University of the Witwatersrand. And it included Chris Hani Baragwanath Hospital, which is possibly the largest hospital in the Southern Hemisphere. It's really, really big. Most of it in those days was single level, so it was very spread out. But when I was starting over there and really struggling, it was so intense, and there were just so many sick children around. We had very good teams and good supervision. But someone who influenced me is Professor Frank Berkowitz, who is actually the first pediatric infectious diseases specialist in Africa, to my knowledge, and certainly in South Africa. And this was in 1985. He had just returned from his pediatric infectious diseases fellowship in Denver, Colorado, and where I think he gained a lot by seeing how the collaboration and clinical teamwork, backed up by good, incisive laboratory, everything could come together. And he came back to Chris Hani Baragwanath as an attending, or as we say, consultant. And I absolutely loved working with him. I just loved that approach. Good history, think laterally, think widely, ask lots of questions. do a really good physical examination. You don't forget the fundi, you don't forget the conjunctiva, look at the mouth properly, think of the sinuses, think of everything you can, and put everything together, do some relevant investigations, talk to the experts in the field, even if they're not pediatricians or pediatric, they're there, they're somewhere, and you can find them and get their opinions. And I just absolutely loved working with them. And from that, decided to that this was where I wanted to go. I wanted to be a pediatric infectious diseases doctor. And interestingly, I had the time to do a research project with him, and we studied nosocomial infections in the pediatric general wards of Baragwanath Hospital. So really learned a lot about conducting a study by myself, developing data sheets, working on the data, working with the statistician, trying to understand what was going on. And tremendously beneficial and satisfying to make a contribution there. And that, I think, was the first such study on the African continent, and really just showed how serious a problem it is. And in those days, and that was in 1986, 1987, people were already talking about the post-antibiotic era. There were already organisms that were resistant to all known antibiotics, unfortunately. So it's been around for a long time, and it's actually been particularly gratifying to see how antimicrobial stewardship has now developed from those times, and as an answer to this terrible problem we were documenting. So be passionate and motivated by your subject. Look for good mentors, someone who has time for you, who you like, who you can connect with. Be open and collaborative with everyone around you. Everyone is your colleague, and you can help them, and they can help you, and everyone helps the patients when this happens. So I think those are two components. One of the very difficult questions is one of balance. When are you doing too much and when are you doing too little? How much can you take on and what should you not take on? And that is such a difficult question to answer, and I don't really have an answer for that. My own history has been of taking on much more than I should, and then finding out that actually that was the right decision. I would say for me, the best example was the SHIR trial. That's the Children with HIV Antiretroviral trial, which was the first randomized trial looking at early antiretroviral therapy versus deferred therapy, and also looking at limited therapy, which actually now leads us into the HIV cure landscape, where you have to stop antiretroviral therapy at some stage. So everything was covered in this trial, but when I was asked, do I want to take part in this, I thought, there's no ways I can do this. I've just returned to South Africa. I'm trying to establish a service. HIV services don't exist. Treatment doesn't exist. We'd also joined another research group, the Pediatric AIDS Clinical Trial Group. It was too much, But anyway, I said, yes, yeah, I'm going to do it. And it's resulted in firstly working with amazing people, Dr. Avi Violari from Baragwanath, Professor Di Gibb and Ab Babaker from London. So all of these really experienced, excellent people coming together for a single purpose. And in fact, the original results were released in, I have to think about it, 2007, and the trial started in 2005, and we are still doing work that's led from this trial. Our focus is, in fact, or not my focus, but again, I was lucky to work or to manage to persuade a neurodevelopmental pediatrician to do a sub study in the SHARE trial, and is now doing neurocognitive studies in the SHARE graduates who are now entering university. So it's really been amazing, actually, how that's turned out. Having said that, I think you need to take on as much as you can and possibly a bit more if you can do it, because often we underestimate what we can do, but you still have to balance that with your family life and your personal life and your issues outside of your profession. And it's not easy, and maybe it doesn't work all the time and you think it's not working, but looking back, maybe it is working. And you do need to have that internal balance, looking at your own personality, your own situation, your vulnerabilities, and your strengths to just make your best personal decision. I think that's the best answer I can give, which isn't really an answer because I don't think there is one.
Oh, it's actually absolutely amazing, Prof. Fantastic. Thank you for the very important tips you've shared. I mean, for young pediatric infectious disease specialists like myself, we should be passionate. We shouldn't shy away from taking up extra work. We should work with good mentors, collaborate, network as much as we can. And in all this, try to find a balance between family, work life, and every other thing in between. I mean, those are very wonderful tips. Thank you so much, Prof. And it has been a wonderful discussion with you today,
Thank you. And
Prof. It has been a pleasure learning from you and listening to you sharing these very, very important insights about WSPID, about pediatric infectious diseases. And it has been absolutely amazing. Thank you so much for making our time to join us on today's WSPID podcast. And I do wish you a very beautiful day ahead. Thank
And
you.
thank you too. It's been wonderful to chat. And I should also just add one last thing. The advent of Microsoft Teams and Zoom has just been amazing, how it's connected all of us. I think there's a Nobel Prize there for somebody for making this facility available to all of us.